This is Dr. Gregg Carb, and this video will demonstrate foam roller stretches for the shoulder. Foam rolling the shoulder may help with the recovery of athletic injuries, ease the effects of postural strain, and generally improve mobility. Let's take a look at the parts we'll be rolling, starting with the front of the shoulder. The chest muscle that connects from the breastbone and collarbone to the arm bone is called the pectoralis muscle. On the back of the shoulder, there are several muscles in a small area, including the deltoid, which also wraps around the side and the front of the shoulder, and the infraspinatus and teres minor muscles, which are part of the rotator cuff, and the teres major and latissimus muscles that start from under the shoulder blade. Looking through the rear deltoid muscle are the tricep muscle tendons, and at the outer shoulder is the lateral part of the deltoid muscle. Since there are quite a few structures in a small space, we only roll about an inch or two on each pass, and it is prudent to go slowly because some of the structures in this area can be quite sensitive, and we'll only spend about 1 minute on each structure. In particular, be careful at the very middle of the armpit or axilla, where the nerves and vessels going from the neck to the arm pass through just under the pectoral muscles at the very top of the arm. So let's now review the foam roller techniques for the shoulder, including the pectoralis, triceps, latissimus teres major, infraspinatus teres minor, and the lateral deltoid. First, the pectoralis in the front of the shoulder. Lie down with the roller at your axilla and roll your arm inward. Push back and forth with your body weight, pushing firmly downward on the pectoralis muscle. Here's another view of the same thing. The triceps attachments are worked from the shoulder joint down the arm an inch or two, and you'll also be working some of the posterior deltoid muscle at the same time. Just roll back and forth between the axilla and the upper arm with slight inward and outward arm rotations. The latissimus and teres major is like the triceps and rear deltoid, except you are rolling from the axilla toward the bottom of the shoulder blade with slight inward and outward rotations of the body. The infraspinatus and teres minor are further toward the back of the shoulder, so you will roll your body backwards a bit, then go back and forth again from the axilla down toward the bottom of the shoulder blade. The lateral deltoid can be tricky to pin down on the roller, so put the side of your entire upper arm on the roller to stabilize it and roll from the underside of the arm to the top of the shoulder. These techniques can take a few sessions to get comfortable with before you start making a difference, so be patient and persistent. Try these stretches once per day and contact your healthcare professional with any concerns.